Nine, eight, seven, six, five, four, three, two, one, zero.
Hey, are you okay?
Well, it's been getting hard for me to get in morning, so I am a bit tired and slow. Plus, my joints are feeling stiff lately. It's hurts to even move.
Oh no, Stacy, let me take you to the doctor.
Okay, but quickly because it is hurts.
Stacy Philip, please come with me. So, your friend told me that your joints were feeling a bit stiff and that it's difficult for you to move.
Yeah, it's been happening a lot lately.
Why don't you take a seat over there? Stacy, you have the symptom of rheumatoid arthritis.
What exactly rheumatoid arthritis? So, how exactly did I get RA?
Well, that's up for the debate. Some research said that it's partially genetically caused a disease. Others say that the cause has nothing to do with the genetic.
What could happen if didn't treat properly?
Well, RA causes bone thinning, heart disease or stroke, lung problem, infection, depression, anemia is a disease called as vasculitis.
Are my cells weak? Is it why this is occurring?
Not exactly. Your immune cell mistake or other cell invader or virus and attack them by a mistake. This causes the joint to weak and eventually lose their shape.
How did research about rheumatoid arthritis?
Actually dating all the way back to the 1500 before century, rheumatoid arthritis has been around. It started to when someone began to have symptoms, causing the doctor to question what is exactly the symptom caused by. A man by the name of Albert Baring Garrett is credited for name RA. Recently, scientists discovered that aerobic exercise has a possible encourage sleep to your mood and improve your condition and movement.
How does get structure of my cell related to lack of function in my cell?
White blood cells have a nucleus that take up most of the cell. The nucleus have to cell division in order to multiply white blood cells so they can. The white blood cell attack the cartilage and joint instead of the enemy in the presence of RA. Then the joint stiffness leaving your pain and suffering.
Hey, Stacy.
Thank you for taking me a Sam. Learn a lot about the disease I ever called rheumatoid arthritis. Dr. Winkers really helped me out.
Anytime, Stacy.
Rheumatoid arthritis is an autoimmune disease that causes chronic inflammation of the joint and other areas of the body. Rheumatoid arthritis can affect people of all ages. The causes of rheumatoid arthritis is not known. In rheumatoid arthritis, multiple joints are usually, but not always, affected in a symmetrically pattern. According to the American College of Rheumatology, in November 2013, the Center for Disease Control and Prevention announced data estimated that 52.5 million US adults suffer from arthritis, equating to about 25%.
Pathogenesis. The disease has important component: immunologically reaction, increased degradative enzyme. The chronic inflammation caused by RA leads to rise epicidin level. This be leading to the anemia of chronic disease where iron is poorly absorbed and also secreted into macrophages. The red cells are normal size and color normocytic and normochromic.
The IgM rheumatoid factor is produced by the plasma cell as an antibody to native IgG, which are altered in RA. Leukocytes are attracted to the immune complex, forming the deposit over the inflammatory surface of the synovium. This leukocyte ingests fibrin and immune complex and is called the rheumatoid cell. Leukocyte release the lysosomal enzyme that cause acute inflammatory response and tissue necrosis as well as inflammatory mediators, IL-1, IL-6, TNF-alpha. The chondrocyte respond to stimulate by TNF-alpha, IL-1 other inflammatory mediator, causing cell to become activated and secrete the metalloproteinases, which lead to cartilage damage. The causes of the rheumatoid arthritis is hereditary, fact in environment, autoimmunity, and vitamin D deficiency. Hi everybody, today I would like to tell about the sign and symptom of the RA. The first one is joint pain and joint tenderness. The second one is joint swelling, redness and warmth. The third one is fatigue. The fourth one is stiffness of the joint, particularly worsened in morning. Many joints affected, both sides of the body affected symmetrically or asymmetrically.
Has included blood count, serology for check rheumatoid factor, X-ray or MRI, and aspiration of the joint if an effusion is present. The doctor diagnosed the patient by following the criteria. First one, morning stiffness in and around the joint, lasting at least 1 hour before maximum improvement. Second, at least 3 joint areas simultaneously have soft tissue swelling or fluid. Third, swelling in the wrist, metacarpophalangeal or proximal interphalangeal joints. Fourth, symmetrical arthritis. Fifth, rheumatoid nodules. Sixth, serial rheumatoid factors. And 7, radiographic changes. The RA is defined by the presence of at least 4 of the 7 criteria above. There is no curative agent available for RA, but drugs are available to prevent the disease deterioration. Symptoms are controlled with analgesia and non-steroidal anti-inflammatory drugs and NSAIDs. The use of disease-modifying anti-rheumatic drugs, DMARDs, to prevent the long-term irreversible damaging effect of inflammation of the joint. However, surgery may require to restore the functions of the joint. The doctor will refer the patient for physiotherapy treatment, which include hand management, gentle stretching, and strengthening exercise. Remember, do not stretch swollen joints or apply heavy resistance exercise that cause the joint stress.